Today, if you notice, we're all wearing red. Why? It's National Wear Red Day, when everybody's encouraged to wear red to bring awareness to women's heart health. Cardiovascular disease is the #1 killer of women in this country. Did you know that? This morning, we're looking at sudden cardiac arrest. That means an abrupt loss of heart function. Every year, more than 350,000 out-of-hospital cardiac arrests occur in this country. And the studies show that women are less likely than men to receive CPR from a bystander. Why? And less likely to survive a cardiac event. CBS News senior medical correspondent, that's Dr. Narula, who is a cardiologist with Northwell Health, has a story of one woman who suffered a sudden cardiac arrest at a very young age and credits CPR with saving her life.
Happy birthday to you.
Celebrating another year of life is something Jenny Lynn Carpio does not take for granted. In 2005, she almost died.
I was 22 years old when I became a new mom. I was a new wife, and I was a college student.
Jenny Lynn was visiting her mother, Jocelyn, with her then 2-month-old daughter when she decided to take a nap.
And next thing I remember, my mom frantically pumping at my chest, yelling at me to wake up. A police officer was shining a light in my eyes, and my mom had said that you just experienced a sudden cardiac arrest.
Jocelyn was trained in CPR, but she never expected that she would use it to save her own daughter's life.
Seeing my daughter having that thing is kind of scary.
About 90% of people who suffer out-of-hospital cardiac arrests die, but performing CPR more than doubles someone's chance of survival. At the hospital, doctors discovered Jenny Lynn had an undiagnosed genetic heart condition that can cause irregular heart rhythms, putting her at risk for sudden cardiac death.
I was shocked. I had to process that this was going to be a lifelong thing.
Surgeons implanted a defibrillator in Jenny Lynn to detect and shock her heart when abnormal and dangerous heart rhythms are detected. She has now had 4 defibrillator replacement surgeries, the most recent in 2020. With this device, Jenny Lynn is living a near normal life and using lessons learned from her own experience to bring awareness to sudden cardiac arrest and the importance of CPR.
What I would like other people to know in regards to sudden cardiac arrest is that it can happen at any time to anybody, and that knowing CPR is a life-saving skill. And that is why I'm here today.
Jenny Lynn Carpio is now a volunteer spokeswoman for the American Heart Association, and she hopes her story will help encourage others to learn CPR.
It's so jarring that it happened to her at such a young age.
It is. And that's what's so, you heard the word sudden cardiac arrest.
Yeah.
Many times there is not a warning sign. And so it is important to know your risk factors and your family history, but also to know how to do CPR so you can act in that moment.
But are there warning signs?
So sometimes there can be. And, things like chest pain or shortness of breath, lightheadedness, passing out, or palpitations. We in cardiology always encourage people, if you experience any of these, you really need to pay attention to them. Don't downplay them or minimize them, and bring them up to your doctor.
Is cardiac arrest the same as a heart attack?
That's a great question, and there's a lot of confusion around that. They are not the same thing. So a heart attack can sometimes trigger a sudden cardiac arrest. But basically, the heart attack means there's a blockage in an artery that supplies blood to the heart. And in that moment, the heart cells can die. The heart muscle dies. Cardiac arrest is an electrical problem. So essentially, the heart goes into an abnormal or irregular rhythm, an arrhythmia, and it's not pumping. So the failure of the heart to pump means no blood is getting to the brain, getting to the organs. You can lose consciousness, and really without treatment, you pretty much will die within minutes.
How do you help someone that's having a cardiac event?
So this is the most important question. So, we try to educate people, call 911 and start performing CPR. It's so easy now to learn how to do hands-only CPR. And really, you can, as you heard in the piece, increase someone's chance of survival if you start bystander CPR before even EMS gets there, and also improve their chances of having a good neurologic outcome because you start perfusing or providing blood to the brain. And so we tell people, push hard and fast in the center of the chest, around 100 to 120 beats per minute, to the song Staying Alive by the Bee Gees in your head.
Wow.
That's what you want to think about.
A little irony there, but it also works.
Right.
Yeah.
But why are bystanders, we said in the lead, why are bystanders less likely to help women
Isn't
with
that
CPR?
Isn't
Yes.
that a terrible fact?
Yes.
Right?
Why?
So one of the issues is a lot of times we think, well, it's probably not her heart, right? If a woman's down on the ground, it must not be heart disease, and so that's one thing. Another is they are worried about being inappropriate by touching
About
her.
touching a woman's
They're
breast. I
worried
was
that they
wondering
might
about
hurt
that.
her. But really, 3/4 of these out-of-hospital arrests are occurring at home, and it's so important to learn this. Imagine you're there with your loved one, they're on the ground, and you feel helpless, but you don't have to, right? That's the
Yes.
point of this segment, is to empower people, learn how to do CPR, but also if you have access to a defibrillator, this can
Yes.
be life-saving, and they're so easy to use. They walk you through every step. You just push the button, it tells you where to push the put the pads, and you
Who's
can really
most at
save
risk?
someone's life.
Who's most
How do you
at risk,
reduce
Tara?
the risk?
Right. So there are risk factors, and this is important to know, is that the majority of patients who have a sudden cardiac arrest have underlying structural heart disease. Most often, 70%, it's coronary heart disease, so coronary artery disease. The other 10 to 15% is something structurally wrong with the heart muscle, some sort of thickening or scarring or weakening, or something wrong with the blood vessels. And then the last about 10% are some of these genetic abnormalities that can trigger arrhythmias, like you heard in the piece with Jenny Lynn, which is why it's important to know your family history and to know your risk factors for heart disease.
Yeah, I
high
would have
blood
thought
pressure,
age was a
diabetes.
factor, but she was 22.
Right, so
Scary.
it does increase, the incidence of sudden cardiac arrest increases the older you get, but certainly we see this, as she said, in every population, every age, both genders.
All right, very good to see you. You look nice in red. We
Thank
all got
you.
the
Go
memo. I think it's
red.
important. I think it's important to send this message that we're sending today.
Leading
Thank you
cause
so
of death
much.
for women in
I
this
know.
country.
People need to understand that. Thank you very much, Tara. To learn more about how to properly perform the hands-only CPR and use one of those portable defibrillators, go to our CBS Mornings Facebook, Twitter, and Instagram page. On CBSMornings.com, you can watch Tara, there she is, a demonstration with Tara and an American Heart Association trainer. They say anybody can learn to do this.